Okay, hello everyone. I'm Dr. Dhaval Shah, MD pediatrician. I'm thankful to Baby Chakra, one of the best parenting apps, for giving me this wonderful opportunity to talk on this interesting and very serious issue. So, today we are going to talk about the health hazards caused by the long screen time in kids. How much screen time a day is okay? So, the simple answer is 2 hours a day. Okay, there is not a fixed number, but we can say that 2 hours a day is the maximum limit that we should allow our child to use the smartphone. So in today's era, we all are lost in a digital space and no one is spared. We all are slave of our smartphone because we don't stop using our smartphone when we are tired. We just stop when the battery is discharged. Okay, so let's talk about some serious issues arising because of the prolonged screen time. Okay, so the first is refractive error or the spectacles. Okay, you may have seen a drastic rise in the children wearing the spectacles during initial years of schooling. Along with that, the dryness of eye, that is a serious issue because of we blink lesser than what is actually required. Second is, postural abnormality, and because of that, the chronic neck pain and backache. And then third is the obesity. A binge watching and binge eating. This is very bad combination, along with the lack of the physical activity. So that causes obesity, and obesity itself has so many bad consequences like cardiovascular abnormalities as well as the hormonal imbalances. Okay, and then cosmetic issues like dark circles, wrinkles on the skin, then mood swings, depression, anxiety. You know, actually, we are very lonely when we are using our social media, and that causes so much mood swings, depression, and anxiety attacks, panic attacks. Along with that, sleep disturbances. It is very interesting to know how the long screen time causes sleep disturbance. I would say there is one specific area in our brain that is reticular activating system. In simple terms, I would say it's the sleep center. Okay, and it gets signal from two different areas of our brain. One is basal ganglia, and one is prefrontal cortex. When you are using your smartphone, your basal ganglia constantly secretes the dopamine, and it is nothing but the pleasure giving hormone. So you keep using your smartphone and you keep watching one more episode, and because of that, uh, it does not allow the sleep center to induce sleep. On the other side, the prefrontal cortex, which is much more matured area of the brain, he understands that you are feeling tired, your eyes are tired, so it will ask the sleep center to induce sleep. So now the sleep center is confused what to believe. Okay, so there is a constant fight between the two areas of your brain, and that causes the sleep disturbance. Then comes the autism spectrum disorder. In the smartphone, we have seen increase autism spectrum because of the smartphone usage. And the loss of communication skills and the eye contact. Social media, when we are using meeting language, do not require eye to and children are not able to develop such skills, and they feel very when they are talking is toilet, and they spend 30 minutes, 40 minutes in toilet, and because of that, they just stop the natural urge of passing, and that causes longer time. Then comes weak familial bonding. each and every person in the family with their smartphone. So nobody has enough time to talk with each other, and that causes weak familial bonding. Okay, so then comes the poor scholastic performance. Obviously, if the child continue using smartphone for a longer duration, then he won't do better in school. And one more is the exposure to abusive language, nudity, illegal drug usage, as well as violence. If your child is exposed to such content at very little age, then it will have a detrimental effect on their mind. Okay, we are feeding something which the child should not. And one more is radiation, heat hazard, as well as the blast hazards. You know, sometimes the smartphone blasts and you constantly feel heat when you are using the smartphone, and that is nothing because of the infrared waves which is emitted from the smartphone. In nutshell, I would say your screen is releasing the ultraviolet rays which may damage your eyes, specifically retina. And one more is the radio frequency waves which is required for the communication. And the third wave is the infrared waves which you feel like a heat. Okay. And the last but not least, the inferiority complex. Whenever we are using this social media, you can see many posts regarding the celebrations, engagement ceremony, wedding ceremony, birthday celebration, and all the photos which are usually photoshopped. And the children start comparing those photos with their own skin tone, their own facial features, and gradually they start feeling inferiority complex, and because of this, and children start feeling that each and everyone in this world is happy, each and everyone has reason to be happy, all looks beautiful but I do not. Okay, so this causes inferiority complex. So we have got one question: what health problems do kids face in their later stage of life due to long screen time? As I said, that refractive error is the one which is very common. Second is the postural abnormality, that is chronic neck pain, backache, obesity, obviously, mood disturbance, okay, sleep disturbance, constipation, and poor scholastic performance. Okay, so one more question: how can I prevent and train my kid from spending long hours in front of the screen from a younger age? So, there are, as I said, that in fact, if your child is entangled in any of this issue I have mentioned already, then you may need to see pediatrician or psychiatrist or ophthalmologist as per the need. And that's why it is said that prevention is better than cure. So let's see how can we prevent such long screen time induced hazards. So the first tip for the parents is that practice before you preach. Okay, so children are great imitators, so give them something great to imitate. So don't worry that the children are not listening to you, worry that they are always watching you. So parents are the ultimate role model. We know for the children every word, moment and action has an effect. So decrease your own smartphone gadget use. It's not like that I have motivated you today and you stop using your smartphone for 2 to 3 days and then again you start following your old pattern. So it should be properly planned. There is a term known as e-fasting. So e-fasting means on a particular day of each and every week, all of the family members will keep their phone aside and will spend the family time. Or they will go to picnic, or only one phone can be kept activated for some communications which cannot be avoided. Okay, so this is the tip number one: practice before you preach. Tip number two: give something which is more interesting than your smartphone. So in today's era, I have seen that whenever a child starts crying, parents offer him a smartphone. And as soon as gets smartphone, he stops crying. Is it a good practice? No. That means you are a lazy parent because this is the easiest way to console your child. Okay. So other way, what does good parent do? You can just divert his mind showing some interesting thing in surrounding, or indulging him in some activities, or telling him some interesting fact. And by the time he'll forget the reason why he was crying. So this is the tip number 2, give something which is more interesting than your smartphone. Now tip number 3, listen to your child. In majority of the cases, parents complain that their child is not listening to them. The child remains extremely busy with smartphone, but that's not true. I know many parents do not have enough time to spend with their kids, but whenever you meet your child, show your eagerness to listen to them. Don't stop them while they are telling their story, even if it is imaginary or totally fake. Always encourage them to talk with you. Ask them questions. How was your day? What happened in your school today? How's your friend? So give them ample opportunity to discuss anything and everything. So tip number 4, use parenting controlled applications. As the technology advances, you as a parent needs to advance. As I said, you are a next generation parents. So the old tactics will not work. By using parenting control app, you can allow only selected applications with fixed duration in your child's profile. Suppose your child is attending internet schooling via Zoom meeting. Then you can allow Zoom application for a fixed duration, for example 1 or 2 hours, and then it will automatically stop. YouTube has done very great job. YouTube doesn't allow any adult advertisement, or it has turned off the comment section for the child's content. Tip number 5, eye and postural exercise. Okay, we have got one more question. My 6-year-old needs to watch TV every time during meals and doesn't concentrate on food at all. How can I manage? So I would say a 6-year-old child should understand what their parents uh, wants to talk. So basically, I would say that proper counseling is required. So I was saying that eye and postural exercise. As I said, if your child is attending the e-schooling, then you have to teach your child proper body postural exercise. After every 30 minutes of screen time, it is necessary to take at least 5 minutes of rest and do simple gaze exercise, eye blinking, and massage your eyes with the palm. How much screen time is okay to have for a 7-year-old kid? As I said, it's 2 hours, maximum 2 hours a day. Okay. So along with that, you can use anti-glare ultraviolet rays screen protector for your laptop screen. Tip number 6, do not praise your child. Yes, you heard right. Do not praise your child. I have seen many parents admiring their child in front of everyone that their kid is so smart that he can use smartphone and knows so many features that even we don't know. So such admiration will actually encourage the child to use smartphone. Instead, encourage your child to participate in physical activities like board game, carom, chess, ludo, or outdoor activities like cricket, badminton, karate, swimming. Help them to create a new hobby like drawing, singing, public speaking, spoken English, and then praise them. Okay, my 9-year-old is continuously playing on his phone and doesn't study nor goes to tuition regularly. I'm tired of his tantrum. How can I fix this? So I would say that ask your child to go to a provisional store and buy some grocery for you. So somehow ask them to buy screen time from you. Ask him to finish his meal on time. Ask him to complete homework. In return, you provide your phone for 30 minutes. You can not stop his gaming all of a sudden, but gradually you can counsel and reduce the screen time. That's what you can do. One more tip is don't allow your child to bring your smartphone in the toilet. As I said, it causes constipation. And tip number 8, that is timely consultation with your pediatrician whenever required. Okay, and that's all. Any question? Okay, so as I said, that always offer favorite food to your child while having meal. Or family dinner should be at least preferably organized in dining area rather than the living room. And keep educating them about the health hazards whenever you get an opportunity. So again, I'm telling that screen time up to 18 months of age, there should not be any screen time. Beyond 2 years, you can allow 1 hour, and after 5 years of age, you can allow 2 hours a day. So my take home message is that I know it's difficult to deal with children, but believe me, it is much more difficult to deal with the consequences of the prolonged screen time. So with such a wonderful session, I am Dr. Dhaval Shah signing off. Hope to see you soon again, and you can follow me on Baby Chakra. Thank you.